Okay, so today we're going to talk about a different lens in which we look at thyroid health, and that is really the functional medicine lens. And when it comes to functional medicine, the whole objective is it's focused on the medicine of why. It's identifying the root cause of thyroid dysfunction. So when we, in functional medicine, when a patient comes in with certain symptoms or even an already diagnosed condition in the thyroid, for us, that is the starting point to really dig deeper in terms of what factors have led to the dysfunction in their thyroid. It doesn't stop at, okay, you have a thyroid dysfunction, therefore we'll prescribe some thyroid medication, off you go. Our interest is why you have thyroid dysfunction in the first place, what are the contributing factors, and how can we modify that in order to bring the thyroid back into balance. So really, thyroid disease, as many of you know, is incredibly prevalent. It's probably second to type 2 diabetes and affects every organ system in the human body. And the reason for that, let's review what the thyroid is and the functions of the thyroid. So thyroid is really the conductor of your metabolic symphony. We often think of the thyroid as responsible for metabolic function, but it actually is responsible for much more. So it's that butterfly-looking gland that sits sort of halfway down your neck, sort of above the Adam's apple in males. And it's part of the endocrine system, so the entire hormone system. And then it's a very small gland, but yet very, very powerful. It produces the thyroid hormones that we're going to discuss on the next slide. But essentially, they are every cell in the body depends on thyroid function. And when T4, T3, and all the different hormones are released, they're responsible for regulating your heart rate, your breathing, your metabolism, blood pressure, your menstrual cycle, body temperature. And so it's really important, it's very important that when we consider the thyroid, we look beyond just the direct impact on metabolism. So let's review the different hormones that are produced by the thyroid gland and understand the wider picture of the other organs that are impacting the thyroid. So thyroxine, T4 and T3 that you see here, thyroxine and triiodothyronine, and the thyroid stimulating hormones are all super important for overall health, as I mentioned earlier. In response to a signal from the hypothalamus by this hormone called thyroid releasing hormone, it activates the pituitary to produce thyroid stimulating hormone, which most of you would know as the common blood test that is carried out to assess thyroid function. When thyroid stimulating hormone hits the thyroid, it takes the iodine away from the foods combined with the amino acid tyrosine, and it converts it into thyroid hormone. That's where iodine and tyrosine that comes from protein are really important in creating the hormone T4. Now, while the majority of the thyroid hormone found in your body is T4, T4 is actually inactive. T3 is the active form. So if you can see here, T3 is the active form. And this conversion of T4 to T3 primarily happens in the liver and secondary occurs in the gut. Nonetheless, and it's much more potent than T4, of course. And although this conversion occurs in the liver and the gut, it's important to know that every single cell in the body has a receptor for the thyroid hormone. So it's essentially your body depends on the availability of thyroid hormone in order to set its own metabolic function. Every cell or every organ, every cell in your body has its own metabolic rate. And it uses the T3 as a gauge in terms of activating that. And that basically occurs through the mitochondria, which is the powerhouse of the cell that creates the energy. Think of it as your battery. That's where you generate energy, and we require T3 in order to generate that metabolic energy. Interesting fact to know that melatonin that's made during your sleep actually is needed to convert T4 to T3. We're going to talk a little bit more about how disruption in these different pathways can lead to dysfunction in the thyroid. But here I just wanted to highlight the gonadal feedback, which is coming from the testes or the ovaries, that gives a signal back to the pituitary in terms of how much additional TSH or less of TSH should be produced in order to alter the thyroid hormone. Another really important point is the immune system. So antibodies against protein, TPO and TG, that exist in the thyroid give rise to the common known autoimmune conditions, which are Hashimoto's and Graves', and we'll talk about that in a second. So you can see that the thyroid really is conductor of metabolic symphony in the body, responsible for many of the functions in the body. However, it's dependent on signals from multiple organs in the body. So what are the top signs and symptoms of thyroid dysfunction? There's a bit more than that, but these are the things that when we see in the clinic, it raises our index of suspicion as to a potential thyroid dysfunction. So when we talk about hypothyroidism, i.e. there's not enough thyroid hormone being released to create the optimal function, metabolic function across the body, we see chronic fatigue, and it tends to be worse in the morning, but it's consistent throughout the day. We have weight gain, feeling cold, so lower basal body temperature, dry hair and skin. We see hair loss, often patchy hair loss, menstrual irregularities, water retention, which results in edema, and then muscle aches and joint pains, constipation, and low mood and depression. On the flip side of on the hyperthyroidism side, where you have too much thyroid hormone being released, then we have feelings of anxiety, we have eye protrusion, again, fatigue, hair loss, heart palpitations, heat intolerance. Again, there's a dysfunction in your basal body temperature, increased appetite, menstrual irregularities, tremors, especially in the hands, and weight loss. Now, not necessarily all these symptoms are going to appear in one particular person or the other, but it's important to note that when you have any of those symptoms, you need to consider, okay, maybe I need to get my my thyroid checked. So other important symptoms to consider, especially with the hypothyroidism side, are things like puffy face, swollen eyelids, elevated cholesterol. Again, is a very important signal for potential thyroid dysfunction. The reason for that is you actually need T3 to get to shunt basically cholesterol from the outside of the cell into the cell to start the production of hormones, because all hormones come from cholesterol. So when you have low thyroid function, you are unable to shunt cholesterol and start the production of hormones, which has a profound impact on all aspects of the body. So that's why when you have elevated LDL cholesterol, you should consider assessing your thyroid function. Easy bruising, and enlarged thyroid gland, and low libido. So what about autoimmunity? The two major autoimmune conditions in thyroid are Hashimoto's and Graves' disease. Farah kindly shared her personal experience, and we'll talk a lot about this more in her session. But essentially with Hashimoto's and Graves', it's the thyroid sends a signal that there's a problem, And antibodies are basically created against those proteins. So thyroid peroxidase and thyroid globulin, which are involved in the development of the thyroid hormones, are proteins inside the thyroid, and they only and they should only be there. They should not be exposed to the immune system. What happens is when the thyroid is inflamed or exposed to toxins, it starts to send signals, alarm signals, and the immune system comes to the rescue, and as a result creates those antibodies against them. In autoimmune thyroiditis, the thyroid membrane essentially becomes leaky due to that environmental factors, which we're going to talk about in a second, and gut permeability. So Dr. Alessio Fasano is really the godfather when it comes to the roots of understanding the root cause of autoimmune conditions. And based on his published research and accepted also understanding of autoimmune mechanism, there are three things that need to occur within the body for autoimmunity to occur, and that really applies to any autoimmune condition in the body. So that one is genetic expression, so having the genetic susceptibility for a particular disease, and then the environment in which you bathe those genes. So basically the things that you do on a daily basis: toxic exposure, sleep, the food you eat, the level of exercise, your stress levels, etc. And then intestinal permeability. So how healthy is your mucosal lining, and that's your gut lining. And when we talk about mucosal lining or gut lining, we actually mean all the surfaces that are that line your gut from the mouth, the nasal cavity, all the way down your esophagus, stomach, intestine, large intestine, all the way down to the anus. And the reason why we talk about that, because actually, if you think about it, it's like a hollow tube, and everything that's inside that tube is still outside the body. So the mucosal lining is effectively our field force. It's what prevents things from coming in, or decides whether what should come in and what should not come out. And the immune system sits right behind that lining, and they're in constant communication. The bacteria that lives in that mucosal on the mucosal lining is constant communication with the immune system, and it guides it in terms of when to respond and when not to respond. So if we have dysfunction, or commonly known as leaky gut, when there's the gaps in the gut are no longer tight, and there's openings, that creates inflammation, and that gives rise to autoimmunity due to overactivation of the immune system. And I know Farah will cover this in more detail. So if you have genetic susceptibility, you're bathing your genes in an environment that is going to express those inflammatory genes, and you have intestinal permeability, you basically have the trifecta, the perfect storm to create autoimmunity. When it comes to Hashimoto's and Graves', Hashimoto's is a bit of a trickier autoimmune condition to manage, because you can have elevated antibodies, but your thyroid is still functioning normal. You could also have hypothyroidism, but you could also have hyperthyroidism. So that's why when it comes to Hashimoto's and Graves' disease, autoimmunity in general, it's important to understand what's driving that overactivation of the immune system. Okay, so I love this slide because it gives you an overview of how sensitive the thyroid gland is, and the thyroid hormones, and what factors can actually impact it. So on the left hand of this, on the left side of the screen, you have things that inhibit function of the thyroid, or increase the conversion of T4 to reverse T3. And then on the right hand side of the screen, you have factors that actually contribute to healthy production and conversion of these hormones, and improve sensitivity at the cellular level. You can see here that there is so many points of intervention that we can address in conjunction with medication, or prior to medication. So factors, when we look at first the important thing about production. So if we, to optimize production of T4, it's a very nutritionally dense process. So we need nutrients like iron and iodine and tyrosine, zinc, selenium, vitamin E, B2, 3, 6, C, and D. These are, if we have deficiency in any of those nutrients, we're going to have a poor production of T4. And in particular, selenium, zinc, and tyrosine play a very critical role, as well as iron, because they are involved intimately in the process of production of thyroid hormones. Iodine is kind of friend or foe situation, and Farah will cover it in more detail, but again, very important, but you don't want too much of it and you don't want too little of it. And the right form of iodine is important. So what on the flip side, what affects the production of T4? Stress, and we'll come to it in a second when we talk about how elevated levels of cortisol can actually blunt the production of T4 because it reduces the signaling from the pituitary. So it actually blocks TSH. Infection, trauma, radiation, fluoride that's commonly in your toothpaste actually works as an antagonist because it binds to the same receptor and prevents iodine from binding. And so as a result, we cannot produce T4. Toxins like pesticides, mercury, cadmium, lead, all of these have a negative impact on the production of T4. And autoimmune disease, celiac disease, really important factor that Farah will discuss in more detail. Celiac and also non-celiac gluten sensitivity. So what about the conversion from T4 to T3? Again, really important, because if we can't convert correctly, then we don't have the impact that we need across the body, because remember, T3 is the active form. So factors that increase conversion, as you can see again, it's the presence of selenium and zinc and melatonin during your sleep. On the flip side, if you have, again, high stress, what happens is that chronic elevated cortisol are going to reduce the conversion of T4 to T3 and favor the conversion of T4 to reverse T3. I haven't talked a lot about reverse T3, but the point to mention about reverse T3 is actually a protective mechanism. It's a way that the thyroid and the body use in order to gauge how much T3 needs to be in the system. So to put the brake on, it converts some of the T4 into T3, reverse T3. And you kind of want to have a balance between the two. That's why when we look at a thyroid panel, we want to look at the levels of your reverse T3 and look at the ratio between reverse T3 to T3. So in effect, reverse T3 is a good thing. However, if we have an excessive activation of conversion of T4 to reverse T3, then we're putting in more of the brakes and less of the pedal. And so we're not actually creating any meaningful or effective optimal function across the body. So things like stress, trauma, low calorie diet, so caloric restriction, whether it's carbs or protein, or prolonged times of fasting, all have an impact on reduced conversion to T3 and increased conversion to reverse T3. Toxins, infections, liver or kidney dysfunction, and certain medications. I'll talk a little bit more detail about all of these. Finally, we talk about cellular sensitivity. So remember, earlier I spoke about how every cell in the body has a receptor ready to receive T3 in order for it to set its metabolic function and do its job, whatever that cell is, maybe in the body. For it to do that, for it to pick up the T3 and activate the reaction in the cell, you need vitamin A and you need zinc, and actually exercise improves that sensitivity. Why? Because actually exercise improves tyrosine utilization, which is a building block for one of the mechanisms is tyrosine, and which is one of the building blocks of thyroid hormone. So really, Dr. Jeffrey Bland, who is the godfather of functional medicine, said that the thyroid is the sentinel gland for the environment. So you can see how it's so sensitive. It responds. It's affected by nutrient deficiency, stress, trauma, inflammation, etc. So it kind of acts as the canary in the coal mine. If anything is wrong in the body, the thyroid is going to be one of the first organs to give you a hint that you need to address the imbalance in the rest of the body. And to be honest, almost every patient that I see with thyroid dysfunction has also adrenal dysfunction and gut dysfunction, and we'll come to those later. But also when I see people with gut dysfunction or hormonal dysfunction or adrenal dysfunction, they will have a thyroid dysfunction. Which brings me to the point that thyroid dysfunction doesn't occur in a vacuum. And I really want you to remember that. It doesn't occur in a vacuum. So whenever you have any imbalance in your thyroid, you need to think, what else is going on in my body that this thyroid is signaling for me to consider. So let's start looking at some of those connections. So the guiding principle for functional medicine is that everything in the body is interconnected. Okay? It's not a bunch of organs working at their own in their own way, and somehow they communicate through messengers through the blood. Actually, no, they are all very intimately connected, and our job is to literally work as a detective to find out where are the sources of imbalance, what's driving that imbalance, and how do we correct it so the body can work and function in harmony, because the body has a profound capacity to heal itself, but sometimes we just have to get out of the way of our own body's healing capacity. So while today we're focusing on this node, excuse me, of the functional medicine matrix, which is the hormones, but you can see that hormones is very much affected by every aspect of the body, whether it's the immune system or the GI or your structural integrity, oxidative stress, etc. So let's explore some of those. I wish I could talk about all of them with you, but that would take much longer. But we'll focus on some of the priority ones. So let's talk about the adrenals. We started to touch on that earlier. Essentially, what you need to remember as a message: consistently elevated cortisol is going to have a profound effect on your thyroid function. Direct effect, but also it's going to have effect on glycemic control, so your insulin sensitivity and your immune system response, which also indirectly impacts the thyroid. So what are the factors that elevate cortisol? Chronic stress, and that could be emotional or physical. So for example, like chronic pain, trauma, any past major traumas that have occurred in the past that haven't been resolved, such as the loss of a loved one, major physical accidents, emotional breakdowns. These I see very often, that I have patients who are locked into an unnatural cortisol pattern in their day because of that trauma that occurred years ago and has been unresolved. And basically the body has locked itself in that mechanism and does not know how to unlock itself out of it. Poor sleep is again a major factor in raising cortisol, because sleep regulates our cortisol pattern. So cortisol is released first thing in the morning and then slowly drops during the day. And then melatonin kicks in at night to help you with your sleep. And then it's a nice balance between melatonin and cortisol all the time. When you don't sleep well, you elevate your levels of cortisol, and that has a negative impact on your thyroid. Also, melatonin is necessary, as I mentioned earlier, for the effective conversion of T4 to T3. And sleep is where a lot of the detoxification occurs at night to help and prep the body for the release of the necessary hormones for daily function. Intensive exercise, again, very high intensity exercises with limited recovery lead to high cortisol. Illnesses and food allergies, heavy metal toxicity like mercury, for example, and excess sugar insulin resistance. All of these factors you need to consider when you're thinking about thyroid health. And as I mentioned, this is how how the excess activation of the adrenals leads to dysfunction in the thyroid. It blocks the thyroid releasing hormone from the pituitary, and it blocks TSH, or reduces the level of TSH from the pituitary. So now you don't have any signal going to the thyroid asking it to produce thyroid hormone. And then on top of that, it actually interferes with the production of T4, and it promotes the conversion of T4 to reverse T3, which is the brake. So you essentially don't have any activity. Even if you release T3, release T4, not much of it is being converted to the active form. What about the gut? The gut is a very, very important organ in our body. It's actually, as I mentioned to you, it's our force field. It's how we communicate with the outside world. It's responsible for the regulation of our hormones, the absorption of nutrients, and even the recycling and detoxification and elimination. So it's a very, very, and I'm sure you've all heard a lot about gut health in the last couple of years. It's certainly an important one to consider and think about. So just to kind of share some of the things that you need to think about, that how the gut affects the thyroid and vice versa. So leaky gut or intestinal permeability, as I mentioned to you, is one of the three factors that you need to have present that leads to autoimmunity. So if you have a leaky gut, for many reasons, for example, if you're celiac or you have non-gluten celiac sensitivity, every time you eat gluten, it tears at the lining of the gut, and as a result leads to inflammation of the immune system. The body, of course, has a capacity to reheal, but the more you tear, the weaker the body's ability, or you deplete the body's ability to heal, and so you set in motion this low-grade inflammation. SIBO is another, there's many factors actually that lead to leaky gut, not just gluten, but another one is stress. When you're stressed, your body releases cortisol to help you cope. Cortisol opens up the gaps in the intestinal lining to allow for faster absorption of nutrients, because it assumes that the body is in danger and needs to get as many nutrients as possible to help it get into survival mode. As a result of this temporary leakiness, you end up with increased inflammation. SIBO is another very common dysfunction that we see in the clinic, which is small intestinal bowel overgrowth, and it compromises your digestion absorption capacity. So you're unable to break down the proteins, fats, carbohydrates. You're unable to absorb the right nutrients that are essentially needed for the production of hormones. Beta-glucuronidase is an enzyme that's found in your gut. It's produced by one of the major species, the Bacteroidetes. And when this enzyme is elevated, what it actually does, it repackages the excess estrogen that was basically dumped by the liver for excretion, repackages it and dumps it back into the bloodstream, creating an estrogen dominant state. And elevated estrogen, we'll come to talk about it in a second, but it produces thyroxine binding globulin, which essentially binds to thyroid receptors and it reduces thyroid hormone availability. It basically sends a counter signal to the hypothalamus and the pituitary actually in particular, and results in a reduction in thyroid production and availability. The thyroid, on the flip side, when you have low thyroid, you end up with slow moving gut. So it basically slows down what we call the motor migrating complex, which is responsible for the peristaltic movements in the gut. And then if you have an unhealthy gut or imbalance in your gut flora, or you have leakiness in your gut, or inflammation, or SIBO, or IBS, any form of gut inflammation is going to lead to malabsorption of your thyroid medications. So we see patients who are on thyroid medication, but they're not feeling better. Often the case is that their gut is inflamed, and they're having symptoms, gut symptoms that are leading to poor absorption of their thyroid medication. So you correct that, you get improvement. Goitrogens is something that Farah will talk about, but essentially from in the gut perspective, it disrupts those types of foods. They disrupt the production of the thyroid hormone by interfering with iodine uptake from into the thyroid gland. So they compete with iodine. And so you can see that the gut is really essential to be investigated when we have thyroid dysfunction. Because again, recall from my earlier slides, is significant conversion of the T4 to T3 occurs in the gut. Okay, let's talk about infertility and thyroid connection. So any disruption in the hormones, in the sex hormones, is going to have an impact on the thyroid, and vice versa. Disruption in the thyroid has an impact on fertility. So one of the key points to mention, I raised it briefly earlier, is that you need T3 to shuttle cholesterol into the cell to start the production of sex hormones. So if you don't have enough of the thyroid hormone, you're unable to shuttle cholesterol through, and you will reduce the amount of sex hormones being developed. In most, first and foremost is progesterone. If you have a situation where you have estrogen dominance, we talked about this earlier. Again, estrogen dominance signals a reduction in thyroid availability and thyroid hormone availability. Stress, again, massive factor in thyroid dysfunction, because it results in what we call the cortisol steal, where the cortisol is one of the hormones produced as part of the sex hormone cycle. So as I mentioned, all hormones come from cholesterol, and think of it as a train track, and it can go, the train track can go towards production of progesterone, and then from there it splits to create aldosterone, which is responsible for managing your blood pressure. It can go to cortisol when you need more cortisol in your system, and then it goes down a third track, which is your sex hormone production, which involves DHEA, testosterone, estrogen, etc. When the body has a higher demand for cortisol, it shunts away all the resources towards the production of cortisol, and then you get a reduction in your sex hormones, and as a result, that has a negative impact, knock-on effect on your thyroid. Luteal phase dysfunction is something we see very often in fertility, connected with thyroid, and that's when you have very low progesterone during the phase post-ovulation, where you actually need enough of the progesterone to allow for implantation and thickening of the lining. What happens is, again, we see low progesterone correlated for many reasons, but one of them correlates with low T3 in the body. PCOS is, again, another very well-studied connection between it and the thyroid, especially in autoimmunity. Patients with PCOS, women with PCOS, are 3 times more likely to develop autoimmunity, in particular Hashimoto's. And the reason for that, there's a lot of hypotheses and let's say mechanisms that are being studied, but one of them is the result of disruption in insulin, because you get increased insulin resistance. You have increase in leptin, which is your satiety hormone, the hormone that helps you stop eating, you feel full. And so when you have high leptin and high insulin resistance, and you have increased fat, that has a negative impact on your thyroid and leads to hypothyroidism. Rapid weight loss, again, because of severe nutrient deficiencies, leads to thyroid hormone. So again, I wish I could go through this in a lot more detail, but please do ask questions to the chat and towards the end of the session. But my whole point here is to get you to see that there are multiple factors that could be at play that are leading to thyroid dysfunction, not that you need to consider. Immune thyroid connection, again, a very important factor, especially when it comes to autoimmunity. There are known key players that we investigate when we're looking at Hashimoto's or Graves' disease case, and that is a chronic infection with Epstein-Barr virus. It also very well documented to have an impact on increasing autoimmune reaction towards the thyroid. Candida overgrowth, H. pylori. There are a plethora of studies that show treatment of H. pylori results in improvement in autoimmune thyroid disease. Lyme disease, infection with blastocystis hominis, commonly seen as an overgrown pathogenic bacteria in the gut. Yersinia, and also food allergies such as gluten and dairy. So with the thyroid, you've got to remember, the higher the inflammation, the more cortisol is released, the more negatively it impacts the thyroid hormone. So where does that take us? So you can see that when somebody comes in with those symptoms, and we have symptoms of hypo or hyperthyroidism, and our index of suspicion is high, and we want to explore what else is going on in the body, because as I mentioned, the thyroid dysfunction doesn't occur in a vacuum, and there are multiple other system imbalances that are at play. So again, this is a really nice way to understand root cause medicine by Dr. Jeffrey Bland. So if you think of the disease as a giant weed that's sprouting out of the body soil, so in your garden, this giant tree, what above the ground is easier to see, and in many ways it's easier to treat. But unless you dig down into the roots, you can never uproot it. So you'll only contain it, but you won't be able to treat it. So what we want to do is, we don't want to do symptom management. We actually want to reverse the dysfunction. So how do we do this? We really start by understanding your life story, because the story of your life is the story of your health. We talked, especially with autoimmunity, for example, we talked about genetic predisposition, environmental factors. And we also talked earlier about gut health, hormone health. So when I have patients with thyroid issues, I'm interested to know, what is their genetic predisposition? Were they born naturally? Were they breastfed or bottle fed? What was their diet like? Have they experienced any traumas in the past? Any medication that they've taken or currently on? Have they had PCOS when they were younger? How was their period? Was it irregular? What about gut issues, constipation, diarrhea, history of reflux or use of antacid medications? So we really want to explore every possible connection to the thyroid so we can remove that trigger. So we look at physical signs of nutritional deficiencies, again, because that's really essential for the production of hormones of T4 and the conversion of T4 to T3. And this is a whole area that we get trained at in functional medicine, but essentially we want to see straight away whether there's any nutritional deficiency we need to consider. So zinc, very easy ways, things like white spots on the nails or brittle nails, a fissured tongue, so a tongue with grooving, hair loss, impaired smell, acne or poor wound healing. These are all signs of zinc deficiency. We think of selenium, that's anxiety, hair loss, again, also poor wound healing. We look at iron and ferritin, fatigue, very common sign of low iron or ferritin in the body, breathlessness, mood swings, a red and inflamed tongue, ridging on your longitudinal ridging that's on the nails, When we think of iodine, that's again fatigue because you're unable to produce enough thyroids. There's low body temperature. Again, that's the result of thyroid dysfunction because it's the regulator of your basal temperature. You get swelling in the neck, you get dry, flaky skin. Vitamin A, very easy way. I always check keratosis pilaris, especially on the back of the arms or the back of the lower legs. Poor nighttime vision, dry lips. And vitamin D, you have low mood and depression, also burning scalp, severe vitamin D deficiency used to people who complain of burning scalp. So these are very quick ways that we can look at and we think, okay, if there's a deficiency, we have to correct that deficiency because maybe correcting that deficiency would be sufficient to correct the imbalance in the thyroid. And Farah is going to cover this in more detail. How about testing the thyroid? So really the big elephant in the room here is that is TSH enough? So a lot of times I see that patients are only being tested for TSH or only TSH and T4. The problem with only testing TSH is one, TSH is released by the pituitary and not the thyroid. And it doesn't reflect the conversion story between T4 to T3. It also doesn't tell us whether there is cell sensitivity to absorb, to connect and absorb T3. It also doesn't reflect whether we have excessive conversion of T4 to the reverse T3. So it's insufficient. We cannot look at that one marker and say that you have hypo or hyperthyroidism. You really need to look at a full panel. And this is the full panel as a baseline that you need to get whenever you measure thyroid function correctly. You need to look at the TSH, the free T4, the free T3, the reverse T3, and then of course your antibodies. And in functional medicine, we look at a tighter range simply because we're looking at range for health, not the absence of disease. If we wait till person's TSH is way below 0.4 or way above 5.5, the ability to correct that becomes much harder. So we want to look at optimal reference ranges that promote health. And so these are the tighter reference ranges that we look at and on that basis address thyroid function. And remember that there is individual variability and that we need to take the patient's story, your story, as we assess the test. You have to put it in context. And we also cast a wider net in terms of our assessment. So again, we look at not just physical signs, but we test in the serum and in the urine, your levels of key nutrients. We look at liver function, kidney function. We look at the adrenals, how much are you producing cortisol and DHEA. We look at your gut. And we look at levels of oxidative stress to identify if you have high toxic load or any toxins in the body. And then we also look at your sex hormones, as I mentioned, because they play a big role in the feedback mechanism for the pituitary and subsequently the impact on the thyroid. And then we check for medications. There are so many common medications that are taken that actually impact the conversion of T4 to T3. NSAIDs, beta blockers, birth control pills, estrogen replacements, proton pump inhibitors, lithium, I mean, the list goes on, but these are really very common ones that we look at. And if that is present, we try to understand, not only because they lead to nutritional deficiencies, but they actually interfere directly with that conversion. So the key message here is that the thyroid gland is the canary on your coal mine. So whenever there's a dysfunction in the thyroid, you need to think, what else is going on in my body that's driving this dysfunction? And what do I need to correct it? So the take home is that we need to look at the roots, not just at the branches. We need to recognize the problem by analyzing the full patient story. Thyroid disease, hypothyroidism, or autoimmunity or hyperthyroidism doesn't just occur overnight. It's due to a series of things that had occurred in your life that led to that point. And so we need to understand the triggers and the mediators that led to this dysfunction. We want to accurately diagnose and treat the causes of this thyroid dysfunction. As I mentioned, we want to look at the liver and the gut and the adrenals the nutritional deficiencies, and we'd like to correct any imbalance that occurs there before we even consider thyroid medication. We check for celiac disease, gluten sensitivity, heavy metal toxicity, and then we use the right testing panel. It's really important to use that expanded test panel to really assess the full spectrum of the thyroid function. And then we want to support the thyroid function, and we do that through lifestyle changes, mainly by removing triggers and addressing mediators, and we supplement with nutrients, phytonutrients, and herbals. And then we prescribe thyroid hormone replacement therapy as needed by the patient. So it's tailored, all of this is tailored towards your story, your health, your triggers, your mediators, and your causes. So just a small note on thyroid medications. So there's different types of thyroid medications. There's synthetic forms of just T4. There's a combination of synthetic forms, and then you have only synthetic T3. Important to know that with synthetic T4, if the issue is in the conversion element or cellular sensitivity to T3, as we talked about, so it's a further line, it's further down the line, the dysfunction is further down the line, just treating with T4 is going to be insufficient, and patients actually don't feel better because we're not treating the real problem. So people tend to do better sometimes on those synthetic combos, but there's also the desiccated form of thyroid, which is made from pigs, and this is called bioidentical hormones. They mimic and act as closely as possible to our hormones, and these are the different brands that are available. The ones that are highlighted are those that are known to be gluten-free. So any patients that you know have gluten sensitivity or are celiac need to be put on those particular brands. It's also, we need to be careful not to switch between brands because there's a variety within the same class in absorption capacity. And Farah will also nicely talk about timing in terms of your meals and when to take medications. So my key takeaway for you is one of my favorite quotes from Rumi is that maybe you're searching among the branches for what only appears in the roots. So really take the time whenever there's a consideration of thyroid dysfunction, whether you have it or you think you have it or you have family members who are suffering from it, is to really think beyond the thyroid. Don't, first of all, test the thyroid accurately and look beyond the thyroid because it is really the canary in your coal mine. Thank you so much. And now over to you, Farah.
Thank you so much, Amal. That was extremely informative and very comprehensive. Okay, let me share my screen. Okay. Okay, so let's get talking about food. Can you see my screen? I just want to confirm.
Yeah.
Yeah. Okay, perfect. Okay, so I'm just gonna go over once again this slide that Amal shared, and just to show you and to reinforce the key message that nutrition and nutrients have a role to play at every single stage of thyroid hormone formation. Okay, so any disruption in any phase can really impact the ultimate goal of producing the active form of thyroid hormone or T3, and then it getting into the cells and being effective in playing its role. So let's start with iron. And I just want to also point out that nutrition is important in the management of thyroid disease, but also some individuals could potentially reverse their condition, depending, of course, what caused it in the first place, the root causes, but also in the prevention. So over time, over the years, the accumulation of nutrient imbalances and other, let's say, toxin exposures can really sort of overfill the bucket, and then the thyroid or thyroid disease occurs. So it can play, nutrition can play a role in prevention, management, and maybe even reversal. So iron, often underlooked, especially the fact that conventional medicine tends to focus on certain parameters. So let's say when you take a blood test, they will just, some doctors will find that your levels are in the normal range. Again, normal does not mean it's optimal, particularly optimal for you. And one often overlooked parameter is ferritin. So ferritin is the storage form of iron, and we really need ferritin. So ferritin is needed for the transport of thyroid hormone, or T3, into the cells. So the range of ferritin is usually quite, there's a large range. So we want to find your level somewhere in the middle. So some functional medicine doctors would even say that it should be at least 60, 70, 80, so sort of in the higher end, as opposed to it being on the lower end, let's say in 15, 20. So again, something to think about, that when it's in the lower end of the range, then you really need to up your intake of iron-rich foods, and supplementation might be required. So iron also helps in the conversion of iodide into iodine. And we know that we can get iron from particularly animal-based foods. So beef, lamb, chicken, seafood. And then there's non-heme iron, which the body does not absorb as well as heme iron. So heme iron comes from animal-based foods. Non-heme iron comes from plant-based foods such as spinach, pumpkin seeds, legumes like beans. So those are still good sources of iron, but not as good as the animal-based foods. And we can boost the absorption of non-heme iron by consuming vitamin C-rich foods alongside plant-based sources of iron. Okay, so if you're having, let's say, some spinach or spinach salad, having some lemon or orange slices in that salad as well. And on the other hand, having tea, coffee, sometimes even high fiber-rich foods that contain phytates can negatively affect the absorption of non-heme iron. Okay, so having coffee and tea an hour after a meal is recommended, even though in a lot of cultures, it's very common to have tea with the meal. Okay, so one thing to keep in mind. Iodine, as Amal said, iodine is very controversial because having too much can trigger autoimmunity, or having too little can also trigger autoimmunity or thyroid conditions. So maintaining that balance is really, really important. Now we can test for iodine. Usually it's done through urine tests, but it's always best not to consume too many foods that are rich in iodine, and if you are thinking of taking supplements that contain iodine, to always check with your naturopathic doctor or functional medicine doctor, just to make sure you are not taking too much. So iodine is really important because thyroid hormones consist of iodine. And then diets that are either low or high in iodine are associated with hypothyroidism. So it's not always, we don't really know if this individual has autoimmunity or thyroid conditions because they lack iodine or they're taking in too much iodine. Okay, so if you do have particularly Graves' disease or Hashimoto's, it would be worth it to limit how much iodine you take, particularly if you eat a lot of seaweed snacks or let's say kelp noodles or seaweed foods, even things like spirulina. Do consume those just a few times a week because some people complain or feel that their symptoms are increased when they have a lot of iodine. Okay, so seaweed, iodized salt are usually good sources of iodine. Selenium and zinc both are extremely important in the conversion of T4 inactive hormone to T3 active thyroid hormone. Selenium can also help reduce thyroid antibodies if you do have, let's say, Hashimoto's, and then it protects against oxidative damage. So any oxidative stress, free radical formation in the body, selenium can really act as an antioxidant and prevent oxidative damage that can further affect the thyroid. And then some enzymes that are involved in producing thyroid hormone also rely on selenium. So selenium really has several roles to play in thyroid conditions. Now, it's not unusual that individuals, again, with thyroid autoimmunity consume selenium supplements. But again, you can take too much and toxicity can occur. So about 200 micrograms of selenium should be okay. And then you can also find selenium in some food. So Brazil nuts are an excellent source of selenium, though again, depending sometimes on their origin, the amount of selenium could differ. Okay, but on average, if you take 2 to 3 Brazil nuts a day, you could be meeting your selenium needs. And then we also, other sources are seafood, of course, like sardines, salmon, chicken, eggs, and certain mushrooms. Now, it's believed that if you take, if you are consuming selenium supplements, if you take myo-inositol in addition to selenium supplement, this could make it more effective and it could further reduce thyroid antibodies. So zinc, once again, plays an important role in converting T4 to T3. It acts as a cofactor on the thyroid receptor, and it can help increase T3 and reduce reverse T3. So zinc deficiency, if an individual is deficient in zinc, and I just want to say a key point that there's a difference between insufficiency and deficiency. Okay, so a deficiency, to get to a deficiency, your intake must be really low and your stores are really depleted. But insufficiency, so even with an insufficiency, even if you are consuming sufficient amounts of a nutrient, you might not be absorbing them very well, then this can still cause an insufficiency, not necessarily to the degree of a deficiency, but an insufficiency can still lead to certain conditions, in this case, thyroid issues as well. Okay, so it's really important to differentiate between an insufficiency and a deficiency. And if you do consume zinc supplements, then it's important not to go overboard. So possibly 20 milligrams, 30 milligrams is okay, but consuming too much can have a negative effect on copper and iron. And we always want to promote getting nutrients from food. So even though I'm discussing supplementation, we always want to ensure that we are consuming a varied diet in order for us to get a bunch or all of these nutrients. So food sources include oysters, which are very rich in zinc. We may not consume them very often, but red meat, poultry, legumes, pumpkin seeds, and dairy products as well. So also a quick note, if you're a vegetarian or a vegan, it's important to keep in mind that you may be lacking in certain nutrients, such as maybe iron, zinc, vitamin B12, which is also very important. And vitamin B12 is found in animal-based foods. So it's worth getting tested for those levels and working with a nutritionist to see how you can incorporate more of these nutrients into your diet. Okay, so this should actually say vitamin D and not zinc. Forgive me for this error. So vitamin D, of course, is a sunshine nutrient, and a deficiency is very, very common worldwide. Okay, so a few foods do contain vitamin D, but usually we either get this from the sun or many of us actually have to resort to supplementation. So before you supplement, please do get your labs, your vitamin D status checked. And people with autoimmune thyroid disease tend to have lower vitamin D levels, and vitamin D levels, particularly if they are in the lower end, are also linked with higher antibodies and abnormal thyroid function. Vitamin D also plays a really important role in immunity, and you may have heard that there's a very close link between vitamin D and everything that we're seeing nowadays with COVID. So vitamin D is important for immunity and for thyroid function. Make sure that if you are supplementing, you are getting your vitamin D from D3 instead of D2. Okay, so a few sources include fatty fish, fortified dairy, and eggs. Some other important nutrients to consider also for thyroid health are vitamin A, which we find in liver, beef, and beta carotene. So beta carotene is found in all yellow and orange fruits and vegetables. Vitamin C, such as spinach, broccoli, citrus fruits, B vitamins, whole grains, legumes, meat, and tyrosine. So tyrosine is also very important in the formation of thyroid hormones and alongside iodine. Okay, so tyrosine is an amino acid, and you can find it in beef, chicken, tofu, and some dairy as well. Okay, so Amal did briefly mention goitrogens, and goitrogens can be of concern if somebody has thyroid conditions, particularly thyroid autoimmunity. So what are goitrogens? They are substances that are found in certain foods, particularly cruciferous vegetables, like broccoli, cabbage, cauliflower, bok choy. And we know that these foods are extremely nutritious. They have high levels of antioxidants, but they're also very important for detoxification. However, they can act as goitrogens, meaning they produce a goiter or an enlargement of the thyroid gland. Now some studies have shown that these are only of concern if someone has low iodine, but I would still recommend being very cautious when you consume goitrogen. So let's say if you are having a green smoothie every day and you have Hashimoto's, for example, or Graves' disease, then you may want to reconsider. Okay, so limit your intake of raw cruciferous vegetables, and cooking and fermenting breaks down their goitrogenic activity. Okay, so it's important that we still incorporate those in our day-to-day diet, but best to have them in a cooked form as opposed to the raw form. Soy is also a goitrogen, and unlike the cruciferous vegetables, with soy, cooking it does not denature its goitrogenic activity. So you will find that some functional medicine practitioners ask anyone with a thyroid condition to avoid all soy, or to really limit soy intake and soy products. So things like tofu, edamame, miso, anything that stems or is produced from soy. Okay, so the isoflavones in soy can really lower thyroid hormone synthesis. So you find that soy is very controversial. However, if you do have thyroid autoimmunity, please do limit your intake to about 2 times a week, and do take it away from medications because it can reduce the absorption of thyroid meds. Gluten. Okay, so you may have heard, or you may not have heard of gluten being an issue with individuals with thyroid disease. So, and it can contribute in different ways. Okay, so if you look at this sort of figure or diagram over here where it says molecular mimicry, you can find that gluten, casein is the protein in milk and dairy foods, and thyroid tissue, they pretty much resemble one another. Okay, so the immune system can mistaken, gluten, can mistaken between gluten and the thyroid. It can therefore, it sees gluten as a foreign thing or a foreign body, and then it can think of the thyroid as the same and therefore start attacking the thyroid. Okay, so gluten, again, it has a similar protein structure to the thyroid, and therefore the immune system can mistaken the thyroid and start attacking it. Many individuals with celiac disease who are unable of breaking down gluten, and it can cause a wide variety of symptoms, and it can damage the lining of the small intestine, tend to have Hashimoto's. So many individuals with autoimmunity, thyroid autoimmunity, have celiac disease and vice versa. So it's important that anyone diagnosed with one or the other is screened for the other. Gluten can also cause leaky gut. So Amal spoke about gut health and the importance of gut health. Gluten can negatively affect the lining of the intestine, of those bonds that link the cells of the small intestine, and gluten can sort of break down these bonds or bring them further apart, which makes it easier for undigested food particles to go from the small intestine into the blood, and therefore trigger immune reactions and increase the risk of food sensitivities. So gluten, again, can negatively affect the lining of the small intestine. Now, even if you do have a thyroid condition, but you have tested negative for celiac disease, and you feel that gluten still bothers you, then you may have non-celiac gluten sensitivity. Even if you don't have both, I would still suggest going off gluten. The best way to determine if you are sensitive to any food is to eliminate it. eliminate it for at least a month or even 2 months, because it can take time for the antibodies to come down. For gluten, it can take up to 6 months for any antibodies that your body has formed against gluten to fight it off to come down. Okay, so consider going for an elimination diet. And gluten, by the way, is not only in your obvious foods like bread, pasta, but it's also in things like couscous, burghol, even in certain sauces like soy sauce, marinades, a lot of packaged foods. Okay, so always read the label to ensure that it does not contain any gluten. And there are tons of options nowadays or alternatives that can be good substitutes for gluten, though please make sure that they are not very processed. Okay, so a lot of gluten-free foods are still very processed. So it's always best to read the label. So gluten, again, can be very inflammatory and can be very problematic to many individuals who are struggling with thyroid conditions. So eliminate it and monitor your symptoms. Try to keep a food journal and a symptom journal to try and monitor any symptoms that have vanished or that tend to reoccur when you reintroduce it. There could be some other potentially aggravating foods for individuals with autoimmunity, thyroid autoimmunity, so such as grains, so any grain, so even rice, oats, and there are a lot of foods that can also have cross-reactivity. So even if they are gluten-free, like rice and gluten-free oats, but they can still act like gluten. Okay, so if you have eliminated gluten from your diet but still have certain symptoms, consider eliminating other grains. Okay, so even things like corn and soy also can act like gluten. Eggs, dairy, remember we said casein, the protein in dairy, which can be very inflammatory, is very similar to gluten. Legumes like beans, some nuts, pistachios, peanuts, and nightshades. So, and this is where not, one size doesn't fit all. We always say that you gotta eat your fruits, you gotta eat your vegetables, but there are certain vegetables like nightshades, for example, they can really be problematic for people with autoimmune disease, especially if you have joint pains, rheumatoid arthritis. Then nightshades would be worth taking out of your diet at least for some time and then reintroducing to see your tolerance. So nightshades are tomatoes, potatoes, eggplants, and spices derived from seeds like mustard seeds, even paprika, curry powder, etc. Okay, so gut health, as we spoke about. So this is the lining of the small intestine, and then these are usually, there are bonds between those cells. The further the cells are, it means the bonds aren't very tightly linked together. So anything undigested can enter from the small intestine into the blood and trigger food intolerances and autoimmunity. Okay, so this is not only gluten, this can be other toxins that we find in food, toxins that we even put on our body, so not even in our body, on our body, like for example, beauty care products with certain toxins that can affect hormone balance as well, certain medications, antibiotics, pathogens, again, bacteria, yeast, so all of those can trigger inflammatory conditions. Okay, so this is a leaky gut. So intestinal permeability or leaky gut is when the gut becomes leaky and things, toxins, undigested food particles go from the small intestine into the bloodstream. And dysbiosis is an imbalance of gut bacteria. So good bacteria versus, let's say, bad bacteria. This can also affect gut health. Okay, so gut health, it's important to maintain the intestinal lining, to heal the lining, but also to ensure that we have a balance, or of course, more good bacteria versus bad bacteria, or more good yeast versus not so good yeast. How do we improve gut health? High fiber foods, foods rich in polyphenols like fruits, vegetables, and then we have probiotics and prebiotics. Probiotics are foods, so probiotics are the bacteria, and prebiotics act as food for bacteria or for probiotics. So we need both. It's not only important to focus on the probiotic rich foods or foods with bacteria, they need to feed on something, okay? And they will feed on prebiotics. When we talk about gut bacteria, it's important that we focus on having a high amount of good bacteria, but also a diverse population of bacteria, because there are so many strains, so many different species and they have different roles to play. Okay, so it's important that we get in a bunch of different probiotics. So foods that are considered as probiotics, fermented vegetables like sauerkraut, that can easily be made at home from cabbage. Okay, so you only make it with salt and water, nothing else. Apple cider vinegar with something called mother, pickles that are made only with water and salt, nothing else. And then of course, yogurt and kefir, if you are able to tolerate dairy. Nowadays, you may be able to find coconut-based yogurt and kefir, also with live cultures, but of course, it's recommended for individuals who are sensitive to dairy. Prebiotics, apples, oats, unripe bananas, flax seeds, chia seeds, onions, leeks, garlic. So those are excellent sources of prebiotics, and they act as food for probiotics. Please do stay away from any foods that are high in sugar, fried foods, vegetable oils, like sunflower, corn oil that are very high in omega-6, alcohol, processed foods. Those can all negatively affect gut health. They damage that lining that we spoke about, contribute to leaky gut, but can also negatively affect that balance between our gut microbes. Okay, and it's important that we support our thyroid with good digestion. So we could be eating all the healthy foods in the world, we can be getting all our nutrients, but if we are not chewing well, if we are not breaking down the food very well, if we're not absorbing our nutrients, then we're gonna struggle with different conditions. Okay, so it's important to sit down at the meal. I think many of us, I'm guilty of this sometimes. I sit in front of my laptop, eat a meal. So it's important to go back to the basics of focusing on whatever it is that you're eating, chewing food very well, okay? And to stop eating when you are 80% full, to go for herbal teas after a meal, for example, chamomile, peppermint, ginger. You may need to support your digestion with digestive enzymes and hydrochloric acid. So thyroid can contribute to issues with low stomach acidity. As a result, if you do have low stomach acid, it's going to be difficult to absorb certain nutrients. Okay, so stomach acidity is important to break down proteins and also for absorption of certain nutrients. So one way that you can boost stomach acid is to have water with some apple cider vinegar. However, if you have a history of an ulcer, please don't do this. Or there are supplements with HCl. Lemon water is also great to help stimulate the release of bile and certain digestive juices and enzymes. And a note on certain beans, legumes, that in order for us to digest them well, it's important that we soak them. Okay, so sometimes you may have to soak nuts, grains, beans, legumes, chickpeas, lentils, at least overnight. First of all, it helps your body digest them better, but it also gets rid of certain compounds that can negatively affect, let's say, your thyroid. Okay, so lectins, for example, agglutinins are certain compounds that can negatively affect your thyroid. So by soaking your legumes and grains overnight, it would really help break them down. Certain botanicals, so for example, ashwagandha is very commonly used for individuals with thyroid conditions. It's an Ayurvedic herb. It's been traditionally used to treat stress. It has immunomodulatory effect, or can really help balance the immune system. It acts as an antioxidant and has anti-inflammatory functions, and it can increase T3 and T4. But just one word on ashwagandha. If you have thyroid autoimmunity, ashwagandha is considered a nightshade. Okay, so again, best to work with someone who's familiar with, let's say, functional medicine to really assess if you could benefit from ashwagandha or not. Essential oils, I love essential oils. You can use them honestly for so many purposes. If you struggle with anxiety, if you struggle with joint pain, if you struggle with sleep issues, with thyroid issues, with hormone imbalances, you can diffuse essential oils in the house. You can put them on your body, so on your wrists or on your temples and behind your ears. Just make sure that you are mixing them with coconut oil or any other oil. almond oil. So those that can help with thyroid, frankincense, lavender, lemongrass, peppermint as well. Okay, just a note on calorie restriction and intermittent fasting and even keto diets. Look, again, it's not a one size fits all. So it's really important to see what's going to work with your body. For me, intermittent fasting, I always recommend that my clients do intermittent fasting, where they do an overnight fast, starting off with 12 hours and then pushing it to 14 hours, maybe even 16 hours. Now, would I recommend going for long-term fasting, so where you're not consuming anything for several days? It would really depend on you. Okay, so I would take it on a case-by-case basis. But for intermittent fasting and overnight intermittent fast, I think this would, the benefits tend to outweigh any potential risks. Now, calorie restriction, the issue with calorie restriction is that it can reduce, some studies have shown that it can reduce T3, and then you also risk not getting enough nutrients, so protein, healthy fats, even grains, carbohydrates. Okay, so we still do need grains, and of course, vitamins and minerals. Ketogenic diets can be effective for some, not necessarily. It's important to work with someone who's familiar with your condition and to see what can work with you. Now, ketogenic diets, if you are struggling with stress, high cortisol levels, adrenal fatigue, then it's best to treat that or address that, and then look into going on a keto diet. Okay, and to monitor your thyroid levels frequently. Okay, so it's important to keep those in mind. And also the hypothalamus and pituitary gland needs glucose to function. Okay, so TSH consists of glucose molecules. So if you're eliminating all carbohydrates, for example, in your keto diet, then this is something to keep in mind. Now you can, for individuals, so with a ketogenic diet, the carbohydrates are really restricted, but some individuals can still be in a state of ketosis with a little bit more carbs, so maybe 50 grams a day. Okay, so it really depends. A few notes on thyroid medications. Please make sure that you are taking your thyroid medications on an empty stomach, because meals can delay gut absorption. Coffee, high fiber meals can affect absorption of thyroid medications. Please take those an hour apart. Same with soy foods, if you are taking soy foods. Calcium and iron supplements, and also chromium supplements. Many individuals take chromium if they want to balance their blood sugar levels, if they have insulin resistance. Those should be taken 3 to 4 hours away from your thyroid medication. Okay. Environmental toxins, very important. So Amal did mention that thyroid gland is very sensitive, and it can highly be affected by toxins. Okay, so toxins come from our air, our water, our food, even our furniture, our clothes, our detergents, our skincare products. So please go for organic, use natural, organic beauty care products. Consider going for an air purifier and a water filter. Endocrine disruptors as well. Okay, so those can block production of thyroid hormone. It can affect the conversion of T4 to T3. So once again, eat organic, ditch any plastics, use glass containers, never heat food with plastics, and go for BPA free items. Okay, and even your cookware. So consider going for stainless steel, glass cookware. Very quickly, halogens, bromine, chlorine, fluorine, those can all negatively affect iodine uptake, because they are very similar in structure to iodine. Okay, so the body can mistake it, or the thyroid can mistake it, and take fluoride. So fluoride, for example, toothpaste is one of the biggest culprits. So we recommend individuals go for fluoride-free toothpaste. And then chlorine is found in water, drinking water, pools, bromine, and a lot of baked goods. Supporting detoxification is so important. Okay, so detoxification, our liver is responsible for our detox, but also our kidneys, our gut. So we have to ensure that an individual is clearing out toxins effectively from the body. So those are certain nutrients and herbals that can support the liver. And then it's important that the individual is going very regularly to the bathroom, passing stool, because this is one way where we get rid of toxins. And we get rid of toxins as well through sweat, okay, through exercise, through infrared saunas, and of course, increasing lymphatic flow in terms of a massage. So all of these can be really effective in terms of detoxification. So as a wrap up, please don't forget, keep in mind that it's a bunch of nutrients that we need for optimal thyroid function, to take into consideration goitrogenic foods, gluten, other inflammatory foods, and we need to optimize gut health, detoxification, not to be shy or not to shy away or be scared about consuming botanicals, so herbals, essential oils, and to keep in mind that we have to opt or to minimize exposure to toxins. So thank you so much. I hope that was informative and it answered any questions you have.